President and CEO of the Asheville Area Chamber of Commerce, and welcome to this conversation about reopening of businesses and specifically the healthcare industry. I saw on the news this morning that Business North Carolina reports that statewide there's been a $3 billion hit on the medical industry through May. So I know it's of concern to everybody. I want to express my appreciation for the level of collaboration between the public and private sectors during this crisis. It's one of the silver linings of this moment. And the town halls we're holding today and tomorrow are another example of how we've worked together. So let's talk about what this meeting is and isn't. This meeting is about giving the health department the opportunity to listen to business owners about your ideas and best practices around safely conducting business as we continue to deal with COVID-19. It's also a time for them to hear about the things that you haven't figured out yet, whether it's where to obtain enough masks or sneeze shields or gloves, or how to ensure social distancing is accomplished when you're ramping back up, or any of the hundreds of other issues business people have to deal with when operating during a coronavirus. What this meeting isn't, it's not a time to lobby the health department about whether or when we reopen or not reopen. You won't come away from this meeting with a deadline for when you should prepare to reopen either. What you will get is a better understanding of how those decisions will be made. We are recording these sessions and we'll be asking you to make use of the chat feature to give your input. That will allow the health department to have a literal record of what you've said. And we're doing 7 of these in 2 days, so the transcript from the chat feature will help. Today we'll hear from Fletch Tove, Public Health Emergency Preparedness Director for Buncombe County. And then we've asked representatives of the industry to serve as conversation starters who may spark ideas or questions you want to pursue. And we'll ask a series of questions that we'll ask you to respond to in the chat feature so that we get that transcript. We hope that by doing this, we can identify any community-wide barriers that we need to address, that the health department will have a better context for decision-making about businesses reopening, and that you as an owner or a manager will start your preparations for reopening so that you're ready whenever that day comes. I also want to let you know that what we're collecting here are ideas. Just because we discuss an idea and like it does not guarantee that's the way things will go. It is the health department's responsibility to determine which ideas provide adequate safety, not ours. So let's get started. Let's have Fletch share with us the latest from the county.
Hey, good morning, everyone. So I want to give everybody an update on the most recent developments that happened late last week. So Governor Cooper and his COVID-19 task force laid out their roadmap to a new normal. A couple aspects of that. One is Dr. Mandy Cohen talked about the metrics and data we need to see moving forward to begin our reopening process. I won't get into the details of that right now, but it's things like our case count and capacity at the healthcare systems and PPE capacity. The other part of that, they're talking about a 3-pronged approach on that roadmap: increased testing throughout the state, increased capacity for contact tracing, and those downward trends. The second half of that conversation was Governor Cooper laying out what he sees as his phased approach to reopening. Phase 1, easing off initial restrictions, and then with phase 2 and phase 3, easing off and opening up some services that have been restricted. I think what's important for everyone to realize right now is that according to the latest plan from the state, if everything goes to the best case scenario, we're looking at getting to phase 3 sometime in July. So just understand that this isn't a a problem for May. This is a May, June, July process. So get in that mindset. Best case scenario, we're looking at weeks and months of this reopening process as it stands now. And that's what we're looking at locally in the county. We're trying to mimic the data trends and analysis that the state's doing at a local level. So we have that local snapshot, and we're working to what the phases might actually look like here. We're expecting some further guidance later this week from the state about the nuts and bolts of how those phases will operate. But we're working in parallel on our own right now until we get that guidance, just to make sure we're making headway. So that's what I have for my update.
Well, at Fletch, let's talk for a second about how businesses can be prepared to reopen. I would think, this is from a non-healthcare perspective, that these folks would be better prepared than many other types of business. And for example, we know that elective surgeries, for example, have been canceled out of an extra degree of caution for everybody involved. What's your thought process around the healthcare industry? Would they be on the front end of things in terms of coming back and reopening?
Right. So from both our local orders and the state orders, a lot of healthcare industry was deemed essential. In our initial iteration of our stay home, stay safe, we did limit elective surgeries, but we didn't have that limitation present in the most recent iteration of that. But what I would think, as you guys look into, as the rest of the community reopens and you guys potentially see a surge in cases or different demands on your services as they become available, is again, probably focusing on PPE, on how your staffing would work, what your shifts might look like, what your capacity for persons inside your facilities look like, and things like that. But part of that is knowing that, but also developing the checklists and standard operating procedures for going through with that. And it's kind of what the discussion we want to have later here is, as you start thinking through those problems, what your industry and what your business might look like at phase 1, 2, and 3, is what those needs are, what those gaps are, what kind of ideas you guys have to conform for those different levels of guidance as those different phases unroll, and to codify that.
Well, Fletch, hang with us, because we've got a couple of guests with us that I want to introduce. Jeff Heck is the CEO of Mayhack, and Stefan Magura is the CEO of Emerge Ortho. And I imagine that I know that Emerge Ortho has stayed open, and Mayhack has been right in the middle of everything. So they may have some ideas or strategies for how things could be reopened, and maybe still have some questions about others. So Jeff, let's start with you. What are your thoughts about reopening the industry? And unmute yourself. There we go.
I just did. Thank you. So I think there's many strategies, and this is the right time to start thinking about it in a phased-in approach. The most important thing in terms of reopening is a dogged commitment to the same strategies that we've been using related to social distancing, using PPE in circumstances where there's a high level of exposure. Those are still going to be, that's still going to be the bedrock or the foundation of safe return to work. And that's, we found in the healthcare industry that even just following those alone without having even the massive testing ability, is we've been able to keep the infection rate of healthcare workers at a fairly low level. So for example, Mayhack, we have 750 employees. We've been seeing patients. We have some essential services like not only primary care, but also OBGYN, babies are still being born, surgeries, etc. And we have yet to have a positive case in one of our healthcare workers. So I just can't emphasize enough that in the right setting, with using social distancing and PPE when necessary, the risk can be can be much lower. The second strategy that is going to have to occur is we're going to have to be able to do the kind of the pillars of public health, which is case finding, isolation, follow up on contacts, and testing. There is still some capacity for testing, but not to the degree that people would like. I think I've been talking to some college presidents, for example. It's going to be important to be able to test and reassure parents that their students are safe to return to school, that faculty, staff, and their fellow students are free of the disease, and that there's a mechanism for quickly testing when that's necessary. And that's true in really in every industry. That's going to be the case. I would say that in reading the newspaper that talks about testing being a little bit of a madhouse, like the Wild West, trying to see who gets supplies, that is true. I can't think of a day that's gone by in the last 2 weeks where I haven't had some lead for testing, for finding new ways to get supplies that hasn't led to great hope for being able to do massive testing, down to the despair of not being able to get it in time. So that's what we need. I think MAHEC is prepared, and I think many of our providers across the region are prepared to do a lot more testing. We did a survey supported by Buncombe County of all the primary care physicians in Western North Carolina, about 120 practices. And when we looked at what do you actually need, the practitioners, about half of them said that they had enough supplies to last 2 weeks. 4 weeks. Only a quarter had enough supplies, enough PPE to do it for any longer than that. And we also were able to identify that about somewhere around 45 practices have the capability of doing testing if they have test kits and if they have PPE, which means that all these primary care practices in the region and also, of course, the health departments are standing ready to be sources of testing for businesses and schools, etc. But we've got to have the equipment. And there's shortages of supplies, there's shortages of swabs, there's shortages of reagents for the equipment that are still impeding our ability to do enough testing.
Well, that's interesting. I was having a conversation with somebody from the Dogwood Health Trust, because I know they've been working on obtaining PPE. And I was, for the healthcare industry primarily, I was asking about whether or not there might be a broader array for the business community. So for example, if you're a restaurant looking to have everybody in gloves and masks, those are not, you may have some gloves, but they're going to be gloves that are kind of, I just can't imagine they're going to have the volume they need. Fletch, what are you hearing about the availability of PPE, and has any consideration been given to how we ramp up to meet the need for when businesses reopen?
Yeah, so there's a lot of conversation about continued shortfalls and scarcity of PPE as we look to reopen. I think it's important to note that when we're talking about asking the community to cover their faces, we're using the term face coverings, because it doesn't necessarily have to be a medical use mask for that. So we're being very careful on our end. When we're saying mask, we specifically mean some sort of mask, whether it's a surgical mask or a respirator, N95, N100. And then when we say for the general public, some kind of face covering. So that could, we've seen everything from a bandana to the home stitch masks. So I think that's one way we approach that problem, because we don't want another run on medical supply masks as we start opening up. We want people, and we're trying to, here at the Emergency Operations Center, engage some local resources to increase focused production of those cloth masks. One benefit of those is that you can wash them. So you can, if you have one or two, you could cycle on between days. You know, you could use those for weeks and months, as opposed to the other masks where they might have form and integrity for a week, but really after that, they're going to start falling apart on you. So that's one strategy we're looking at. We're also looking at what level, you know, right now, for the state and for locally, those face coverings are just a strong recommendation when you're in places that you can't meet physical distancing requirements. We're looking at our language on that and how we address that. And if we make that a strong recommendation for any time you're in public, and how we message that, and how individual businesses or healthcare providers can possibly enforce that. So those are the discussions we're having now.
Well, Stefan, I want to ask you, Jeff's operation, 750 employees by any measure, is a large company. And Emerge Ortho is not a small company, and you have maintained operations during this. What questions and ideas do you have about reopening?
By the way, good morning, everybody. And Kit, I missed the last part of your question because I was unmuting.
Given that you have been in operation all during this time, are there ideas you can share about how you've been handling patients? But as we move towards opening up more fully, do you have questions or ideas related to reopening that you'd like to share?
Absolutely. So as Kit mentioned, we haven't closed, but we have certainly changed how we do things on a day-to-day basis. First and foremost, we benefited from the fact that we're now a part of what is called Emerge Ortho. We're just, for those of you who don't know, we were Blue Ridge Bone and Joint. So we're an orthopedic practice with locations here in Asheville, Arden, and Hendersonville, but we're also a part of a larger corporation, Emerge Ortho, which are 5 practices, orthopedic practices across the state. We benefited significantly from the fact that one of the divisions, as a chief medical officer, that was able to be very focused on the steps that we needed to consider in maintaining operations. So we have followed CDC guidelines from day one in maintaining our ability to remain open safely, not only safely for staff and providers, physicians, also safely for patients. So how did we step through this process? Well, the first thing we did was call all patients that were scheduled to be seen starting on a specific date. That's been about a month and a half ago. And we asked those patients a series of questions to determine whether they actually could be COVID infected. If they did answer one of the 5 questions that we asked positively that were related to potentially being infected, what we did was to ask that patient to consider rescheduling, certainly not come into the office. And we were also then able to very quickly, in 5 days, we were able to go from not being able to do, hardly knowing what telemedicine is, so not being able to do and incorporate telemedicine to being up and running so that all of our physician providers, physical therapists, physician assistants, and nurse practitioners could interact with patients via telemedicine. So we offered up as the second option for individuals was to use that, that way in which to communicate with us. So as patients presented at the various and we also, by the way, we also consolidated our operations from 5 office locations to 3. And what we did was then station employees outside as patients were accessing the different locations. We would then review the same 5 questions And actually, those have morphed as different things have changed these last 6 weeks. But anyhow, we would interview patients wanting to be seen. And if there was an issue that was identified, we asked the individual if it wasn't an emergent situation, if it wasn't an emergent situation, we asked the patients to come back and revisit us after an appropriate quarantine time. So once we completed the interviews, if everything was fine in terms of our being able to see the patients based on the CDC guidelines, we registered patients maintaining social distancing, and then we asked patients to return to their cars. And when their time to be seen came up, we called them and stepped through the process of seeing patients. Telemedicine has been a tremendous solution for us in taking care of patients, even to the degree that physical therapy and demonstrations regarding physical therapy are made available to those patients who have some sort of video device, iPhone, etc. Anyhow, I'll talk briefly about PPE. We also were somewhat fortunate in that we made the decision to buy what we could before things really started heating up. So we're talking about mid to later February. Do we have everything that we need? Yes. Do we need additional supplies? Yes. And mainly in the area of masks. But to talk to Fletcher's point, one of the other things that we started doing as we were scheduling patients is asking all patients to come to the office with some sort of face covering. And that's worked extremely well. So we've been able to minimize the use of masks that we have for our staff and providers by asking patients to be coming to the office as I just described. And one thing before I forget, May 4th, next Monday, the 4 facilities where our doctors do surgery are going to allow elective surgeries to restart.
Okay, well, that's good to know because I wasn't aware of what the rules exactly were around elective surgery. Jeff, if you were going to give a recommendation to a much smaller practice, health-related practice that has not been serving people during this time period, what kind of resource would you suggest they pursue to guide them through the process of reopening?
Well, we've been doing that already with some of our primary care practices in the region. So primary care for us would be family medicine, internal medicine, pediatrics, urgent care, and we've been working with them through the results of the survey to find out what they need. The first needs were actually related to how to implement telehealth. How to get it started, what software to use, what are the legal issues around telehealth, billing and coding. Those are all things that we've been having. Either we have virtual conversations with them or actually physically present with them. Most of the practices in our region are really desperately trying to learn to do telemedicine as quickly as possible because their volume has gone down, not just because of guidelines, state or local guidelines, it's because patients are also afraid to come in. And I think Stefan brings up a good point. The offices that we have talked to are being really careful about protecting patients. I know at Mayhec, we're washing every surface, every doorknob, rail handle, table surface, every hour. We have 2 people that walk around all day long, cleaning stuff, disinfecting stuff. So I think patients can feel reassured, and I'm a physician. I'm still practicing myself. I actually have made a couple of house calls in the last week, and in 2 instances, I'm really glad I did, because the patients actually needed to be seen right away. It was a life and death issue for them, and they had been holding off too long. So we also need to get the word out to our community that there are other health conditions besides COVID-19. There's, new cancers and heart failure and, arthritis and injuries. And, there's just all kinds of stuff that continues to happen. And it's why it's just one more part of the whole business sector that needs to get open.
Well, I want to continue to talk. I'm going to invite the audience to please share any ideas or strategies that could benefit your industry in reopening. And gentlemen, you're both related to traditional medicine, but we also have folks in healthcare that are in other forms of medicine, or dentistry, chiropractic. There are all kinds of entities that could be potentially impacted. So if you have any, most commonly, I guess, they just have very close contact with people, with whom, the patients with whom they're working. Would you have any different kind of advice for them, or does it pretty much remain the same?
Hey, Kim, this is Stefan. Can you hear me?
Yes.
Okay, great. So, yeah, to just add to the telemedicine conversation, we landed on what is called doxy.me.com. So that's doxy.me.com. And we tested Google Duo, FaceTime, and CP3. And all of those did not function as well as doxy.me.com. One of the things that we were looking for, and Jeff alluded to this, is that we needed to identify a HIPAA-compliant way in which to communicate with patients. And that's what doxy.me, that's one of the things that doxy.me offered up. So I just want to make certain that if anyone has stepped through the process and hasn't had a successful outcome, they can certainly reach out to me, to us, and Kit, you've got my contact information, and we'd be happy to help folks as they step through this process. Now, the applicability to other folks in the healthcare industry, I'm challenged with dentistry, as you can imagine. Others, though, where it's a matter of interacting with an individual to identify certain things, could really benefit, I would think, to incorporating telemedicine. What's also a nice feature about this is that very quickly the payers lined up and made payment available to providers for as they're using telemedicine with patients.
Good. Jeff, any other ideas you want to share?
Well, I think your question specifically was about the non-health care industries, because I think that's, whether we like it or not, that's also the responsibility of us as healthcare providers, public health, et cetera. I mean, we've got to provide some guidance there. And I would say, it remains to be seen. It's interesting to watch what happened in Georgia. So although they lifted a lot of the restrictions, not everybody went back to work, because there are other factors at play, which is confidence that it's safe to do so. And I think this is one of those instances where communicating well with the your customers, with the people who you're hoping to be in your businesses, is really necessary, and letting them know all the things you're doing to make sure that it's safe to come to you. So I think making sure that they would feel comfortable that social distancing was working. I think some of the grocery stores, for example, have done an amazing job of making lots of modifications to how the flow works. That's been really helpful in maintaining social distancing. And ultimately, I think businesses are going to want organizations like ours, like, the healthcare industry, to help them with testing strategies. And as soon as we get those, we'll be ready to help.
Yeah, no kidding. Well, Fletch, what about you? Do you have ideas for maybe smaller entities, or offices, maybe the dental office or the chiropractor or the acupuncturist? What would you suggest?
I would say that one of the best ideas I've heard is that proactive communications before the visit. So reaching out to them the day before or the day of, and doing that screening over the phone, that general screening, and then asking them to come in with a face covering. I think that proactive step is going to save everybody a lot of frustration and heartache at the front desk. As Jeff said, number one, still physical distancing and PPE are the best tools we have. I'm not an expert on this stuff, but I understand like stuff like the dentist or the chiropractor or acupuncture has unique challenges where you are not just in the room, but you're right over somebody. So I think that's, maybe where you look at using the, I don't know, maybe that's where the N95 masks come in for the people doing that service. Everybody has an N95 in there. I don't know. That's not a little bit out of my wheelhouse, but I think the most important thing is the proactive communications with patients as they're coming in.
Okay. Let's move on to what resources are needed to provide those services. And folks who are in the audience, please enter any ideas about resources that you need to provide services in the chat. And let's talk about it amongst our folks. I think the distinction on masks and face coverings is super helpful, because there is a difference between the two, as we all well know. Jeff, do you guys have everything you need in terms of, or what are you hearing from the individual practices about PPE?
So we're hearing that all of them have some potential shortages, particularly in the near future. But we're trying to help, and I know the Dogwood Trust is trying to help. And there's a lot of organizations trying to help, but it is a concern for practices. And we're learning how to conserve PPE. Also, there's ability to reuse some materials. But I do think one of the things that Fletch was discussing is the whole issue of dentists. When dentists are in somebody's mouth and they're like throwing fomites everywhere, that's a risk to the employee. And the dentists have always been really good about having lots of PPE. But for an example, the whole UNC dental school closed down. That's what kind of risk there is. But on the flip side, we've been, for the last 4 weeks, we've been doing dental emergencies. We've been seeing anybody who's got a dental emergency, and that includes some, drilling and tooth extraction and all kinds of stuff. And again, because of really careful attention to PPE and washing down rooms and all that kind of stuff, we have not had any sick providers so far.
Well, I know that my dentist had plenty of PPE before there ever was the coronavirus.
Yes.
They come in with a face shield, and there's nothing. I guess that patients can wear their face coverings on the way in, but they're certainly going to have their mouths exposed. They're going to have work done on their teeth. So we've got a comment here: clear information on what is protective and what is not would be most helpful. Distinguishing on masks is helpful, but also what type of cleaning products work best. Anybody want to weigh in on that?
I can say just a word about masks, just to build on what Fletch said, is that that the coverings, just face coverings, they protect others from you. So if you cough or sneeze, that helps. In other words, if you're wearing a mask in a store and you cough or sneeze, you're breathing, it actually helps other people. If someone coughs or sneezes on you, it's not as good as a well-fitted N95 because those seal the face well. They've also got a polysynthetic fiber inside the mask, which helps to to remove particles. The other thing a mask does in terms of being helpful, it reminds you to keep your hands off your face. I do see in the chat link, they're also from Ellis Vaughn, who actually is one of our regional experts in the health department here for certain, is that there is there is a good website that she's sharing that you can use for disinfectants.
Yeah, she's got, so Ellis has provided a link to the EPA. So you can go there and use that link. And then we have availability of fit testing for N95s is something at Aledade that we've heard from a number of offices. So fit testing, I guess, would be important. It's not helpful to have a mask that doesn't fit properly. Fletcher, are there any other sources of information about about how you should clean and or which masks to use that you would recommend?
Yeah, as always, we usually defer to CDC guidance here. So the cdc.gov, if you go to their COVID-19 page, they have a lot of resources on, the different masks and what they actually do. And they also link to that same EPA list about cleaning practices, not only the supplies used for cleaning, but the best cleaning practices. I would say at the county, we're looking at options to increase fit testing to local providers. We're still working the issues out on that. As you can imagine, everybody's trying to get fit tested right now. You have to have qualifications to do that, but we're working through about how, as we start reopening, we could go out to the community and provide those first responders or healthcare providers fit testing so they could feel more comfortable using their N95 and that they're getting the protection it warrants.
All right, well, folks, continue to use the chat if you have ideas. I see Advent Health Hendersonville is working with area businesses, nonprofits, and local governments to offer suggestions and guidelines for screening employees and visitors. And they would be happy to share the screening guidelines they've utilized for the hospital to protect their employees and patients. And that's, Graham, thank you for that offer to have people contact you. If you would like to share that information with us also, give us a link to a downloadable version, we'd be happy to get that posted in the FAQ that we'll be doing with these recordings. Please continue to use the group chat function. Let's talk about the gaps in service that still remain based on current guidelines. Anybody have a thought about that they'd care to share?
Well, the biggest gap obviously is testing and the availability of appropriate testing and amount of supplies to step through the process the way in which we would want to step through the process. And I don't have an update on that. Does anyone else?
Well, that's a really good question. Fletch, do you know anything about the availability of tests that you can share?
Yeah, so I can say that testing is slowly increasing in the region, not to the extent we'd like to see, but we are slowly seeing more labs, increasing capacity, LabCorp accepting more tests at the state level. So slowly the capacity is increasing. I do want to point out there's two conversations to be had about testing. One is, and you hear this reference in accordance with the state guidelines of who gets the test, like the capacity question. And for current guidance on testing, the state's saying that we have capacity for that. But then there's a second conversation about what's the testing we should see, and would like to see, and we should be, as a county, seeing thousands of tests a day, and so we're not there yet. So there's two conversations about testing. Are we at capacity for the state guidelines on who gets tested? And right now it looks like yes. And as they open that up, though, and we'd like to see where we want to go, we need way more testing than we're having, and we're trying to come up with solutions, as Jeff was alluding to, chasing down all these loose ends, and then as we spend 3 or 4 days trying to solidify a solution, it's kind of yanked away from us, or updates come that maybe that test wasn't so reliable, or that there's a supply chain issue with reagents. So I think we're seeing the same thing a lot of you guys are, and doing our best to increase our capacity there.
I know that from an advocacy perspective, we have been communicating with General Assembly members on behalf of the business community, saying that when more testing becomes available and when resources come from the federal level to the state level, we've done a good job in Buncombe County with holding down our numbers. And my concern is, or our concern is, that because other areas have higher numbers, that they may see more of a concentration of some of those supplies. So we've been asking about transparency in the process of how they're distributed, as well as ensuring that there's good equity in that distribution as well. Barbara points out that dentists have been experts with PPE and disinfection protocols since the mid-1980s with the AIDS epidemic. That is a really good point. So, and that's helpful to know. And Timothy is asking a question. When we think about even higher levels of control, are there any thoughts about the potential of testing in the dental office? The CDC's hierarchy of controls lists engineering controls such as testing as a higher level of effect, as we can screen staff and patients before treating.
Yeah, can I make some comments about testing? Can you hear me, Kit?
Sure, Bill. Good to see you.
Yeah, so I think, as much as we would all like a much wider availability of testing and have we could have a much better understanding of the prevalence of the disease in our community, we cannot test ourselves back to normal right now. That is not going to be the answer. The answer is continued protocols, both professional and personal, to maintain distance and to treat everyone as if they're positive. There's a number of problems with the tests, not the least of which is their availability, not the least of which is sample collection and their sensitivity, and not the least of which is the antibody test to determine, whether people have been exposed or not, are completely unvalidated. We bought just as an example, we acquired some tests from a company in California that had gotten a FDA EUA, which is an emergency use acceptance, and the long and short of it is we ran a dozen tests on patients we knew had COVID, and it only came up 33% sensitive. So these are tests that the FDA has said are the best that we have right now. So my advice is, don't hold your breath on testing. Hold your breath behind a mask and a face guard, and do everything you possibly can to maintain the distancing as the way out of it. The PPE availability is another issue I wanted to comment on, and the testing too. From a social justice point of view, while it's fair to distribute it equally throughout the state in some measures of fairness, social justice demands that it goes to where the cases are. And right now, there's cases in other places where they're actually treating people, and so we need to make sure that no one has a shortage where they're treating patients while other people are trying to provide, care elsewhere. That's personal perspective, and so we've been rerouting our supplies within HCA to areas in the company where the need is the highest, even if it means we have to delay some of the elective procedures. At HCA and here at Mission Health, we have to start back up our care. Jeff said it very eloquently when he said the patients are getting sick and not coming in to get the care they need. You've probably seen in a host of different publications, both locally and nationally, that our stroke volumes are down, our heart attack care is down, which means not that some magic happened and COVID took over and now there's no longer any heart attacks. It means that people are avoiding the care that they need. And so we have to get back to business. And we've worked in concert and in collaboration with the other chief medical officers, Dr. Teresa Herbert at Advent Park Ridge, Dr. David Ellis at Pardee. I've been in conversations with Rick Bunio at Cherokee and Paul Riggs at the VA, and we all recognize this need to get back to work together. And so we are, in the next week or so and even sooner, going to be expanding the care that we've done in accordance with trying to conserve PPE, make sure we have adequate testing, make sure we don't expose patients to care or to illness when they come in, and then try to get that care back on the board.
So in terms of what, and Bill, I thank you for that, and feel free to weigh in on this as well. I know that all right, so first elective surgery was not allowed, but now it apparently is allowable. True or false?
So first of all, I hate the term elective. Elective only means that it's scheduled at a certain time in the future. It doesn't have to be done in a time-dependent fashion like hell's bells, it's an emergency. So it's, and frankly, you know, I would hope, although there are some procedures where medical therapy may be as good as a surgical therapy, most of what we do is not to be considered unneeded. So we've used the term non-essential or non-time dependent, you know, however you want to talk about it, but all the care that we do, we believe is warranted. The state never issued an edict that said you cannot do elective surgery. They strongly recommended, because again, we were trying to make sure we had testing available, we had PPE available, we didn't consume hospital beds or ICU beds, and we had adequate supplies. So any decision to ramp that up has to take those into consideration. In addition, the county in their initial declaration said you can't do any elective procedures. And then when the county revised their declaration on April 8th, they took that clause out and it's silent on it. So we've been in contact with Commissioner Newman and others, Avril Pinder and Dr. Mullendor with the health department, to talk about what, you know, is it the right time? Is it safe? Is it okay? And it's clear to us that given the low prevalence in the community, the general availability of testing, although it's not as much as we'd like, adequate supplies of PPE, at least in our facility, that it's time to start doing to getting some of those patients back in the offices and the care that they need.
It's interesting because I have a colleague who has a bum knee and knows that she needs surgery, but has apparently the healthcare entity is not doing what they call elective surgery at this point. Fletch, what's your thought on elective surgery? I shouldn't use that term, Bill, but I'm going to keep using it because it's the one I'm familiar with. In terms of the safety protocols that are available, are we in good enough shape to continue to push for elective surgery at this point, especially when a lot of people are home? Any thoughts on that, Fletch?
Yeah, no, I think echo what Dr. Hathaway said. We were looking at worst case scenario when we put that in place. Our initial iteration of the order suspended it because we didn't know what our initial load would look like. The numbers right now, the capacity of the hospital has fortunately been low, so that for that reason we did not. In the second iteration, we didn't have that clause about elective surgery. And I'm in the same book. 2 months ago, if you told me elective surgery, I would have said, that means it's not an important surgery. But, you know, hearing Dr. Hathaway talk and other people, elective is not the right word to use. There should be a better word, because it's pretty significant, serious surgeries that people need. It's just that they have the option to schedule when it happens.
Right.
So, Dr. Hathaway, if you could develop a better term for that, so it's easier to sell and make people understand that it's not elective like you would take an elective class. It's elective like you get to pick what date you'd have this vital medical procedure done.
Right.
Yeah, you know, we've gone to non-essential, but I don't even think that's the right term. I think non-time sensitive, you know, or less time sensitive, because everything needs to be done eventually if we're going to do it at all. So that's essentially where we've gone.
Jeff,
And
any
you know, the other thing that I think is critical to look at is even on the outpatient setting, you know, new breast cancers, new colon cancers, new episodes of heart failure, all that stuff is happening in our community, and we've got to get to that. We've got to get to that right away. We can't have people stay away with potentially serious symptoms. And then if we do detect some potentially serious problem, we can't say to patients, well, you know, you probably need a colonoscopy or some other procedure, but you're just going to have to wait. That's just not, I think that's just common sense. You put that in your own situation, you're not going to want to wait 3 months for something like that to be done. So we're figuring out what all this means, but it doesn't mean foregoing every other type of care.
Stefan, has your practice been continuing doing non-time sensitive surgeries?
Yes. In other words, all of our doctors are on staff at one of 3 hospitals. Those hospitals and their emergency departments are still 24/7, and individuals have shown up during this period of time that need more time-sensitive interaction or assistance. And I do appreciate Bill's point and the way in which he's characterizing the differences and similarities to really what it is that we're talking about. And it would be good to move away from the current vernacular. I also appreciated Bill's point and would want to emphasize the point about testing ourselves out of this situation that we're in. It really comes back to, as everyone has said, the basics. And the basics are personal hygiene, masking, distancing, and an emphasis and re-emphasis on the communication that we all need to hear very routinely about, again, the basics that need to be in place.
Thank you for that. We've got about 7 minutes. Are there any final thoughts that any of you want to share with us before I go into some closing thoughts? Or if you have questions on that, please write them in on the Zoom group chat. We'd very much like to have those. Not only are we doing the recording, we'll be doing an FAQ on the basis of any questions we get. Any that we don't address today, we can address later. Miriam Schwartz, messaging to the public about getting the healthcare services they need would be helpful. I totally agree with that, because I think that we've got evidence right here that people have been avoiding healthcare that they need because out of fear of getting COVID-19. But the numbers are good here in Buncombe County. So people have done a good job in abiding by the various rules. Any final?
Quick, Kit,
Yes.
if I could, a quick comment, please. We do appreciate that, among other things, that we're going to have to maybe build, but also maintain patient confidence in our ability. And I'm just talking about our circumstance. But I would expect that other healthcare providers would need to take this into consideration, the facts that we are employing CDC guidelines, that as has been mentioned, the disinfecting is occurring, in our case, after each patient is seen in a particular exam room. But then also building patient confidence about this new next step, which is proceeding with surgery and all of what it is that will need to be taken into consideration on the part of the patients as they step through that process.
Appreciate that. Jeff, Any final thoughts you'd like to share?
No, I appreciate the challenge that businesses have, and we're standing ready to be helpful as much as we can.
We appreciate that very much. Fletch, any final words that you would like to share with this group?
Just appreciate everyone's support, and I think this is a good forum to hear some ideas and just continuing this relationship as we work through this whole situation.
Great. I just want to point out that we have an email address that you can see on the screen, business@buncombecounty.org. If you have questions, if you have comments, if you have suggestions, feel free to use that email address, please. And I also wanted to make a pitch to business owners who are on the call. There is a new survey the Chamber has distributed to determine the issues you're addressing right now that will impact your ability to reopen. And it can be found at ashevillechamber.org/coronavirus. We would appreciate you completing that. It too will be presented to decision makers, both at the local level, but also at the state level, as they're making decisions about how we go about reopening business in the area. Together, we are far more resilient than we are apart. So I want to thank you for joining us and sharing your collective wisdom with us. Thank you for all who weighed in. Thank you to our speakers and our partners in local government who are working to keep us safe and healthy. And everybody stay safe, and hope to see you in person soon. Thank you.
Thank you very much.